Stop what you are doing for just 1 second and swallow. Swallow your own saliva right now and pay attention to what happens at the back of your throat. Does it feel clear? Or does it feel like something is sitting back there, like something is in the way? Hold on to whatever you just noticed, because by the time this video is done, that sensation is going to make a lot more sense than it ever has before. If you have been dealing with mucus or phlegm stuck in your throat that simply will not clear no matter what you try, there is a real reason for it, and I am going to show you exactly what it is and exactly how to get rid of it. Now, chances are you have already seen a doctor about this, and chances are you walked out being told it is your allergies or a touch of post-nasal drip. Here is a spray, try this pill. But you are here, which tells me that answer did not actually fix it. I will be straight with you. In 15 years of this work, that allergy explanation is correct about a third of the time. Everyone else has been treating the wrong thing, sometimes for months, sometimes for years. I had a woman last year who had been on allergy medication for 4 years for a throat that had never once been about her allergies. So today we are going to find what is actually behind yours, and you will likely spot it as we go through this. Two things in particular are going to surprise you. One is a cause that almost nobody checks, not even most doctors, and it is the one I find more than any other. The other is something you are doing every single day, possibly right this moment, that keeps the whole problem going regardless of what is causing it. And many of you have two of these stacked on top of each other, which is the real reason nothing has worked so far. Let us find yours. Let us start with the one you have probably heard before, because for some of you, it genuinely is the right answer, and I am not going to pretend otherwise. Post-nasal drip. Simple version. Your sinuses produce mucus just like everyone else's do, and instead of running out the front the way it does with a cold, it runs down the back of your throat, pools back there, and drives you absolutely mad. That is a real thing, and it does cause exactly what you are experiencing. It gets worse at night when you are lying down because gravity is no longer carrying it away. It collects at the back of your throat while you sleep, and you wake up needing to clear and clear just to get your morning started. Many people have had this ever since a cold years ago that never quite fully resolved. Others have what is called non-allergic rhinitis, which is simply a reactive, sensitive nose that responds to cold air, strong smells, or a change in the weather with no true allergy behind it at all. Same drip, same mucus, same result. How do you know if this is you? It usually comes with your nose. If your nose is stuffy or runny alongside the throat issue, if it gets worse in spring or fall, if you have always been an allergy person, then yes, this is probably part of your picture. And the fix is genuinely simple. A saline rinse once a day using a small bottle from any pharmacy, a couple of dollars, using distilled water or water you have boiled and cooled, flushes the drip right at the source. For some of you, that single habit is the entire answer. But here is why I am not going to spend too much time here. Most of you have already been down this road. You have done the allergy pills, maybe the spray. If that had been the whole answer, your throat would be clear by now, and you would not be watching this. So let us get to the one that actually gets missed. In 15 years of practice, this is probably the single most common thing I find in people with this exact complaint, and it is almost never what they came in expecting. It is reflux. And I can already feel some of you pulling back right now thinking, that is not me, I do not get heartburn. And that right there is the precise reason this one slips past everybody. Because there is a type of reflux that does not burn, not even slightly. You can have it every single day causing all of this and never feel a thing in your chest. Here is what is happening in plain language. There is a valve at the top of your stomach that is supposed to stay closed. As we get older, it becomes a bit lax, a bit loose. Small amounts of what is in your stomach slip back upward, not enough to produce that classic burning sensation, but enough to travel up and reach the back of your throat and your voice box. Now, your stomach lining is built to handle that all day long. Your throat has no such lining, so it gets irritated, and an irritated throat does what an irritated throat always does. It produces mucus to coat itself and protect itself. And there is your phlegm. There is the thing you keep trying to clear. And it gets a bit more complicated than that. Along with the acid, an enzyme travels up called pepsin, which is simply what your stomach uses to break down protein in food. The problem is that pepsin settles into your throat tissue and stays there. So later, when you have a coffee, some tomato sauce, or a glass of wine, that small amount of acidity wakes the pepsin back up and it begins irritating your throat all over again. Which is why this thing seems to have a mind of its own, flaring up for what appears to be no particular reason. The medical name is LPR, laryngopharyngeal reflux. Most people simply call it silent reflux, and that is an appropriate name because the silence is the entire problem. No heartburn, so both you and your doctor go looking everywhere except the one place it is actually coming from. Here is how you know if this is you, and I want you to be honest with yourself as I go through this. It is usually worst in the morning. You wake up with it and have to clear repeatedly just to get your voice working. Your voice might be rough or gravelly early in the day and then loosen up as the morning goes on. That feeling like there is a lump or a small obstruction sitting back there, where you can swallow food perfectly well, but swallowing your own saliva feels like something is in the way. That is one of the most telling signs there is, and it tends to worsen after eating or after lying down. If 2 or 3 of those just made you think, yes, that is me, then I would put strong odds on this being your answer. There are a few more signs that people rarely think to mention. You clear your throat before you start talking almost every single time, like a warm-up, especially before a phone call. You get a sour or slightly bitter taste some mornings. Your breath is not fresh no matter how thoroughly you brush. There is a dry, tickly cough that brings nothing up and gets worse the moment your head hits the pillow. Some of you notice it flares after the exact same triggers every time. A large late dinner, chocolate, peppermint, anything fried, a second cup of coffee. And some find it acts up most after using your voice for an extended period. A long conversation, an afternoon catching up with friends, and by the end your throat is tired and you are clearing it every other sentence. Then there is the one that really unsettles people. A lot of those with silent reflux feel simultaneously like they have too much mucus and a dry, raw throat at the same time, both at once, because the irritation is producing mucus while the acid is drying and inflaming the surface underneath it. And that lump sensation where something feels permanently stuck, even though food goes down without any trouble, that one frightens people more than anything else. They become convinced there is something growing back there. The vast majority of the time there is not. It is irritation combined with a small amount of muscle tension right at the top of the throat, and it comes and goes exactly as the reflux does. Worth having looked at once to settle your own mind. But for most of you, it is not what you have been lying awake fearing. And one thing I want to say to you directly, if you have started to wonder whether you are imagining this, or if someone has hinted it is just nerves, or you being a worrier, you are not making it up. This is a real, well-understood physical process happening in your throat. I see it constantly. You are not inventing it. You have simply had something that nobody has taken the time to explain to you properly. Here is what you do about it, and this matters more than any pill. Stop eating in the 3 hours before you lie down. That is the most important change. Keep that last meal smaller. Prop the head of your bed up a few inches using solid blocks under the legs or a wedge under the mattress so you are not lying completely flat while acid tries to creep upward. Go easy on the late coffee and the late wine because those are what keep the pepsin reactivated. Do those things and many of you will notice a real difference within a week. A few additional steps if you want to go further. Do not lie on the couch immediately after lunch either. That is the same mistake as bedtime, just in the middle of the day. Loosen your belt and avoid tight waistbands because anything pressing on the abdomen nudges that valve open. And here is a simple one that surprises people. A stick of sugar-free gum after a meal keeps you swallowing, and all that swallowing washes acid back down and dilutes what is sitting at the top. Small thing, genuinely useful. One thing I do not want you to do is dismiss this as harmless indefinitely, because acid and pepsin working on your throat tissue day after day can slowly change the tissue over time. That is manageable when someone is keeping an eye on it, but it is worth addressing rather than ignoring for a decade. Now, for the one I told you that you are doing to yourself. It sounds almost too simple, but I watch it trap people every single day. The throat clearing itself, the very thing you do to get a moment of relief, is a significant part of why it never stops. When you do that forceful throat clear, you are snapping your vocal cords together with real force, and that tissue does not appreciate it. It becomes slightly swollen, slightly raw. Irritated tissue produces more mucus. So you clear, which irritates, which produces mucus, which makes you feel the urge to clear again. People go around this loop hundreds of times a day, completely unaware they are feeding the very thing they are trying to eliminate, and it becomes a habit layered on top of a reflex. Half the time, you are not even clearing real mucus anymore. You are doing it because your throat feels slightly off, and your nervous system has learned that little clearing motion as the automatic response. Watch yourself for one afternoon and you will catch it. You do it walking into a room, right before you pick up the phone, in any quiet moment. That is wear and tear your throat is absorbing all day long for no benefit. When you feel the urge, do not bear down on it. Take a small sip of water instead, or do a quiet, deliberate swallow with no sound at all. I know that sounds like almost nothing. It is one of the most useful things in this entire video. Two more, and I nearly left these out, but I have watched both of them confuse too many intelligent people to skip them. Go look at your pill bottles. If you take a blood pressure medication that ends in the letters PRIL, and many of you do, lisinopril, ramipril, that family of medications is well known for causing a dry, nagging cough and a persistent tickle in the throat. Approximately 1 in 10 people who take them develop this effect, and the tricky part is that it can appear months, sometimes a full year after you started the medication, so it never occurs to anyone to connect the two. I am not telling you to stop your blood pressure medication. Please do not do that without speaking to your doctor. I am telling you to bring the bottle to your next appointment and ask directly, could this be causing my throat problem? Because there is almost always an alternative that works just as well, and the cough simply goes away. I had a patient on one of these medications for 2 full years, coughing the entire time. He had seen an allergist, had a chest x-ray, been through the full workup. We changed that one pill, and within 3 weeks, the cough was gone. He was almost frustrated about it. All that time and worry over a side effect that no one had flagged for him. And here is one more that catches careful, sensible people especially. Many of you, when this first started, did the reasonable thing and reached for an over-the-counter antihistamine, figuring it was allergies and this would dry things up. That is the trap. Those older antihistamines do dry you out, but they dry out everything, including the mucus that is already sitting back there, so it goes from runny to thick and sticky and harder to shift than it was before. The same applies to decongestant nasal sprays. Use one for more than 3 days and the nose rebounds worse than when you started. So if your throat actually became worse after you began treating it yourself, that is very likely the reason. And quickly on milk, because someone always asks, milk does not cause your body to produce more mucus. It simply coats your throat briefly and makes whatever is already there feel slightly thicker for a few minutes. If skipping your evening glass makes you more comfortable, by all means do so, but it is not your underlying cause. If your mornings are consistently the worst part of this, here is why. As we get older, we produce less saliva and tend to drink less because the thirst signal becomes less reliable. You simply do not feel it the way you did at 40. So mucus turns thick and sticky rather than thin and slippery, and thick mucus grabs and sits where thin mucus would have slid right past. Then you spend the night lying flat with the heating or air conditioning drawing moisture out of the air, and any silent reflux creeping upward with nothing to wash it back down. It all compounds through the night and you wake up into it. If you sleep with your mouth open, which more of us do as we age, particularly with a stuffy nose, you are running dry air directly over the back of your throat for hours. That is the sandpaper sensation some of you wake with before you have even had a sip of water. The fix is straightforward and it works. Run a humidifier in the bedroom at night, clean it weekly, and drink consistently throughout the entire day. Warm drinks particularly. Tea, broth, warm water. These loosen thick mucus better than anything sold in a pharmacy. 1 glass of water in the middle of the night cannot undo 8 hours of drying out. It is the all-day habit and the room air that actually shift things. A few more things worth naming plainly because they amplify every cause we have discussed. Smoking, even occasional, and vaping is no gentler on your throat. Alcohol in the evening, which loosens the stomach valve and dries things out simultaneously. Forceful throat clearing, which we have covered, and dry indoor air, winter heating especially. You do not have to be perfect about any of it, but if 2 or 3 of those are part of most days, reducing them will move this further than you might expect. Now with my full clinical hat on for a moment, because most of the time this is a nuisance, and occasionally it is not. If you are ever coughing up blood, even a streak, go and be seen. If you are bringing up green or rust-colored mucus with a fever, that may be a chest infection requiring medical attention, not a humidifier. If your voice has been consistently changed for more than 3 weeks without improvement, or you are losing weight you did not intend to lose, or food is beginning to catch when you swallow, those are not the everyday throat issue we have been discussing, and I do not want you sitting at home doing saline rinses for them. Get those assessed. For everyone else, here is the complete plan in one place. Drink throughout the day, warm things especially. If your urine is darker than pale straw, you are behind. If it is post-nasal drip, a daily saline rinse with distilled or boiled water. If it is silent reflux, and for many of you it is, nothing to eat in the 3 hours before bed, a smaller last meal, raise the head of your bed, and ease off the late coffee and wine. Catch yourself clearing your throat and stop. Sip or swallow quietly instead. That is the one almost everyone skips, and it is among the most effective changes you can make. Run a humidifier in the bedroom at night. And check your pill bottles for medications ending in PRIL, then have that conversation with your doctor. Apply the ones that fit your picture. Give it 2 weeks, though most people notice something in the first few days. One last thing before you go. Remember the pepsin I mentioned? The stomach enzyme that settles into your throat tissue and reactivates every time something acidic passes through? Here is what gets people. Some of the foods that trigger it are ones you consider genuinely healthy. Things you are probably eating at breakfast right now while feeling virtuous about your choices that are quietly keeping your throat raw all day long. There is one in particular, something many of you have almost every single morning, that I watch cause ongoing throat irritation while the person eating it is completely certain it is doing them good. That is what comes next. The everyday foods that quietly feed silent reflux, and the one breakfast habit that may be the reason yours has never fully settled.